Welcome to our channel Cells and Stents. I am Dr. Sudeep Rai, consulting hematologist. Today I will discuss hematopoiesis. This is a very important topic for both MBBS students and NEET PG examinees. So we will discuss this topic under the headings of introduction, site of hematopoiesis, type of stem cell, lineage differentiation and their clinical relevance. So what is hematopoiesis? Hematopoiesis is the procedure of stem cell renewal and differentiation of stem cell into mature cells. Stem cell have two functions. One is self renewal, another is differentiation. Renewal is required as there is limited number of stem cells which can produce differentiated mature cells like RBC, WBC and platelet. There are two types of stem cell. One is long term stem cell, another is short term stem cell. Long term stem cell remain quiescent and short term stem cells have higher proliferation capacity. Hematopoiesis can be divided into two, embryonic and adult. So embryonic stem cell first starts at yolk sac. This is not definitive hematopoiesis, only erythropoiesis at yolk sac at third week of intrauterine life. Definitive hematopoiesis start from AGM region. AGM means aorta, gonad and mesonephros. This starts after fourth week IUL, intrauterine life, and definitive hematopoiesis start from AGM region at fourth week of intrauterine life. Definitive hematopoiesis of bone marrow starts at third to fourth month and continues throughout the life. Adult hematopoiesis, normal hematopoiesis only occurs in the bone marrow. In young children, the complete bone marrow is functional, but at 10 to 12 years, only flat bone remains functional. Other bone marrow are replaced by yellow fatty substance, but retain their differentiation potential when needed. So depend on their potency, stem cell can be divided into 5 types. These are the 5 types. Totipotent stem cell means total potency. They can differentiate into 3 germ cell layer plus placenta. Pluripotent means plural, so only 3 germ layer but no placenta. Multipotent means multiple related cell line. Multiple related. Oligo means limited number of related. Limited number of related cells. Unipotent means only one type of cell but retain their regenerative potential. So depending on this, the cells can be differentiated into multiple types. Multipotent stem cell, which is a hematopoietic stem cell, is a multipotent stem cell. These can differentiate to common myeloid progenitor, common lymphoid progenitor. Common myeloid progenitor developed into common megakaryo and erythropoietic cells, which ultimately develop platelet and RBC. And from common myeloid progenitor, another cell is myeloblast. Myeloblast developed into all type of WBCs. This is basophil, neutrophil, eosinophil, and monocyte. Ultimately, monocyte give rise to macrophage. From common lymphoid progenitor, there is B cell, T cell, and natural killer cell. This is the details of erythropoiesis. Erythropoiesis starts from proerythroblast, then basophilic erythroblast, polychromatic erythroblast, orthochromatic erythroblast, reticulocyte, and mature RBC. RBC starts hemoglobin production from the stage of polychromatic erythroblast. The most immature form, that is proerythroblast, has the deep basophilic cytoplasm and gradually it becomes reddish eosinophilic, and the size of the nucleus gradually is smaller. This is the details of neutrophilic maturation. Starts from myeloblast, then promyelocyte, myelocyte, metamyelocyte, band form, and mature cells. Promyelocyte starts the production of granule, that is primary granule of neutrophil, and from metamyelocyte secondary granules appear. So there are multiple number of growth factors which I will discuss in the next video, but for your information I mentioned 2 to 3 growth factor like interleukin. Most important interleukin are interleukin 2 and 6. These are needed for T cell differentiation and lineage commitment. Another important factor is stem cell factor or c-kit. Stem cell factor helps to homing of the cell in the bone marrow niche. Another important factor is the granulocyte granulocyte monocyte colony stimulating factor or granulocyte colony stimulating factor. So their clinical significance should be known. Why we should know all these things? Because there are some diseases which involve the stem cell like aplastic anemia or congenital bone marrow failure syndrome. So there is pancytopenia. All three cell lineages are less in number. So there is pancytopenia. There is another disease, another leukemia. This is called common chronic myeloid leukemia, CML. CML is a disease of stem cell where the all three cell lineages are increased. There may be diagnostic implication like bone marrow examination and examination of their cellular protein expression like flow cytometry, and therapeutic intervention like bone marrow transplant where hematopoietic stem cell is transplanted to a diseased person. So what should we remember? We should remember this is a theory question, the concept of a disease, the cell maturation pathway, cell differentiation, and hematopoiesis hierarchy. This is needed for our future discussions, and key cytokines which I will elaborate in the next video. Now to conclude, two MCQ questions are here. I will discuss these two. First question, which of the following is the primary site for hematopoiesis in fetus during the second trimester? So the question asks the second trimester. I told you that yolk sac is active in third week of intrauterine life, bone marrow after 3 to 4 months. Normal hematopoiesis never occurs in spleen or fetal liver. So second trimester after 3 months, this is the bone marrow is the site. Which of the following cytokine is the most important for red cell production? Okay, I have not discussed this for today's video in details. The answer is erythropoietin. I will discuss their role, this erythropoietin, thrombopoietin in the next video. So the correct answer is erythropoietin. So please like, share and subscribe this video, and subscribe to our channel for this type of videos. Thank you.